Good morning, everyone. Welcome to the Virtual International Symposium on Dignified and Compassionate Care, organized by the Action Research for Community Health Laboratory, Arch Lab of the School of Social Sciences, Nanyang Technological University, Singapore. My name is Dr. Andy Ho, Associate Professor of Psychology and Medicine at NTU, the chair of the symposium and the host for today's webinar. I would first like to acknowledge and express my most sincere thanks to the Ministry of Education of Singapore for the generous support with this symposium, as well as with the empirical research program on family dignity intervention that aims to strengthen evidence-based and holistic palliative care services in the local context. I would also like to express my deepest appreciation for the Palliative Care Center for Excellence in Research and Education, PALC, for hosting the symposium, to all of our wonderful plenary speakers for their scholarly contributions, and to all of you, our participants, for your amazing enthusiasm and interest in this series of webinars that focus on understanding and supporting the needs of patients and family facing the many challenges of death, loss, dying, and bereavement. We still have a number of people coming in, so as I was going to start explaining some of the procedures that we have for the symposium and the webinar, and hopefully by the time we begin, everyone will have arrived. So over the next few days, actually over the past 2 days, we already have 2 speakers who came on to talk about the experience and the knowledge and the evidence base of dignity and dignity-conserving care in the palliative care context. And over the next 2 days, we'll have 2 other experts to come in to talk about dignity and compassionate care in the context of grief and bereavement. We hope that the symposium and the intellectual exchanges, as well as the connection that is being built through the symposium, will really create a paradigm shift in terms of how we provide more, better support to patients and family facing mortality. The virtual symposium is divided into 5 live stream webinars. We already have 2 over the past 2 days, and 1 joint discussion in the last day, which is on Friday. On each day of the symposium, including today, we'll begin with a brief introduction and a check-in with our panel speaker. Thereafter, the speaker will spend about 70 minutes presenting the webinar, followed by a 15-minute interactive Q&A session. So all of you are encouraged to pose a question to the Q&A window in the Zoom browser, and you're also able to upvote the questions of your peers by clicking the thumbs up icon on each of the questions posted. And because of the time constraint, we will only be able to answer the most popular questions with the most upvotes as decided by all of you. So please do not miss out this great opportunity to interact with our speakers, post any questions and reflection that you may have, and we look forward to this segment at the end of today's program. One more thing to note about your viewing window. As the audience, you have the option to change the size of your viewing window for the presentation and the presenter. Just find the sliding bar in the middle of your Zoom window, and you can then decide how big you want your screen to be. So that's something for us to keep in mind. So we have come to day 3 of the symposium, and I'm most delighted to introduce you to our 3rd speaker, also a wonderful friend of mine, Professor Robert Neimeyer. Professor Robert Neimeyer is Professor Emeritus of Clinical Psychology at the University of Memphis and the Director of Portland Institute for Loss and Transition in the United States. Since completing his doctorate training at the University of Nebraska in 1982, Professor Neimeyer has published 30 books, including a series of volumes on techniques of grief therapy and grief and the expressive arts, and served as editor-in-chief of the Journal of Death Studies. The author of over 500 articles and book chapters, he is currently working to advance a more adequate theory of grieving as a meaning-making process, both in his published work and through his frequent professional workshop for national and international audiences. Professor Neimeyer serves as the president of the Association for Deaf Education and Counseling, ADEC, and chaired the International Work Group for Death, Dying, and Bereavement, IWGDDB. In recognition of his contribution, he has been granted the Emerit Faculty Award by the University of Memphis. He's made a Fellow of the Clinical Psychology Division of the American Psychological Association and was given Lifetime Achievement Awards by both the Association for Deaf Education and Counseling and the International Network on Personal Meaning. Bob, we would love to have you on the meeting, so please do turn on your video.
All right, well, there we go. I believe I'm with you now, visually, if not in person. How I wish I were there. I should have been there at this time, and it would have been lovely to be right there along with all of my Singaporean friends.
Yeah, it's great to see you, and you're right. We would love to have you in here in person, but I guess with the circumstances that we're faced with, this is the best that we can do for now. So just want to check in with you before we start your presentation. How have you been doing recently?
You know, I've been doing more than adequately, but less than perfectly, probably like many of the more fortunate people on the planet. And for me, the biggest source of suffering in this has not been any threat to my personal health. I feel quite safe here in my home and in Portland, Oregon. I get out and I run several kilometers a day and so on. So my activity is not constrained in that way. But my partner, Agnieszka, has been separated from me essentially in lockdown at an ashram in India, in the jungles of
Oh,
India, where she was in February when COVID began rolling in. And she's been
mm-hmm,
in various levels of lockdown ever since with no prospect in the immediate future of resumption of international flights. So it's been
mm-hmm.
a long period of separation for us. And I do have concern for her as basically COVID-19 spreads like a wildfire through that country.
Mm-hmm, mm-hmm. And thank you for, I mean, I'm sorry to hear that, but thank you for sharing that with me. I mean, it's definitely a great deal of concern for safety and for the separation that you've been faced with. How do you cope with that?
Well, I think I've been pretty resilient, but the resilience is really a social construct as much as a personal one.
Mm-hmm,
You know, I engage in my own kind of philosophic coping, and practically I take good care of myself and make good meals here in this otherwise empty house.
mm-hmm,
But I rely on a lot of friends, and Darcy Harris is one of them,
mm-hmm,
with whom I correspond and speak with some frequency to process the experience. And of course, I'm very aware that any suffering that I have or that Agnieszka has pales by comparison to the enormous suffering of so many on our planet. And
mm-hmm,
I think it's useful even in a context such as Singapore, where you guys have done so much better a job of containing this pandemic than our out of control country, um, that even there it's important to bear in mind the many tangible and intangible losses, as Darcy would probably also acknowledge, the non-death losses that the pandemic really foists upon all of us. So, you know,
for
we all
sure.
have much to cope with.
Mm-hmm. And I think along the personal losses and the suffering that we experience as individuals, I think the pandemic has also caused a lot of disruption in terms of palliative and bereavement care services around the world. And how does that look like in the United States?
It is getting better. One good thing about human beings is that we have a tendency to learn from experience.
Mm-hmm.
And so people are finding ways to restore some modicum of engagement of families with patients. And not only in palliative care, but in any hospital context for whatever condition. It needn't be COVID related. The protocols that secure the safety of the patients and the hospital staff require normative distancing, of course, from families. And so they're far less engaged in care than they otherwise would be. It's almost as if we've reversed the progress made in the last 20 years toward family-centered care, as it now becomes radically individualized and disempowering. So we have a lot of work to do of a creative kind as a global community, probably for years to come, in dealing with the immediate threat of the infection. But then beyond that, for the complicated bereavement that's likely to ensue from
Mm-hmm.
people's guilt and disempowerment and just all of the unfinished business, the kind of thing we'll be talking about today.
Right. And on that note, I think we can't wait to share, listen to your sharing in your presentation, which is very much looking at meaning reconstruction and dignity preservation in loss and transition. So with that, I'll pass the stage to you. Please turn on your screen share, and we are dying to hear your presentation. Thank you.
Well, dying is optional in this context at least, so please don't rush toward that state. And let me go ahead and cue up my slides for you. What I would like to do is talk about this idea of meaning reconstruction. And what do I mean by that to begin with? I mean that as human beings, we are attempting to reaffirm or reconstruct a world of meaning that has been challenged by loss. And so the idea of meaning reconstruction suggests that grieving is kind of a process of rebuilding a life that works and building some kind of meaning in the experience of transition or loss itself. I want to do that today with attention to the preservation of dignity in families and in the bereaved in the context of loss and transition. And an image that I'd like to share with you here at the outset is contributed by an Australian artist. And in the late 1940s, James Gleason, whose work I encountered in the large art gallery, contemporary art gallery in Melbourne, Australia, painted this image called The Corrosive Literal of Habit. And to me, it is a portrait of complicating grief. We see here the image of the artist himself on the left foreground. It seems as if he's falling apart. It's just deteriorating, the image. And he's linked by a tattered shroud to the image of a loved one who seems to stand in the distance, we might imagine, and who is herself disintegrating, as if the loss of the other also portends the loss or erosion of the self. And this is the kind of condition that we often enough confront in the context of bereavement, even in the context of good palliative care and hospice. My goals for our time together include the following objectives. I want to summarize for you research that supports meaning reconstruction in adaptive grieving and the struggle for grieving as a risk factor in portending a more complicated or prolonged course of bereavement. I want to share with you several measures of meaning making in bereavement as we move through, at least lightly touching on some that I think have real value in a clinical context. And I want to describe to you some new research programs on the process and outcome of meaning reconstruction approaches to grief therapy. So really to focus on news you can use as practicing professionals, many of whom, of course, among you, I've had the opportunity to work with in past years in the context of Singapore-based training. And I very much look forward to the resumption of that when it again becomes possible. Nous sommes condamnés au sens. With these words, we are condemned to meaning in French. Maurice Merleau-Ponty, the famous French phenomenologist and philosopher, spoke about the basic human predicament. He was paraphrasing Jean-Paul Sartre, whose famous dictum was, Nous sommes condamnés à la liberté. We are condemned to freedom. But I think that Merleau-Ponty was even more on the mark in his regard, in his focus on grieving, because as human beings, we are swimming always in a kind of sea of meaning. We live in an interpreted world. Even at neurological levels, we are all the time discerning and constructing patterns in experience. We're imposing order on unruly perceptions. We are constantly narrating, telling stories about our experiences, about what we feel, about what we believe. We're positing goals and ideals toward which we work and toward which we expect others to move. As cultures, we establish laws and moral codes. We propose theories as scientists. We write fiction as artists, as writers. And of course, just as ordinary human beings, we're always negotiating our social realities with others, whether in our family or beyond, including negotiating those same social realities with those who oppose our preferred meanings and ways of organizing social life. Now, none of this is part of the physical structure of our lives, right? Although sometimes there are reflections of this in terms of, buildings that maintain the law or books that we can look at as tangible stories. But all of it arises from our penchant for making meaning of events. And of course, the difficulty with loss is that it often enough undoes many of those meanings. What I'd like to do is to introduce you here to a client of mine, literally the first 1 minute of therapy with my client, whose name is Darla. Darla has lost her college-age son, Kyle, to an aggressive bile duct cancer that essentially was diagnosed and took his life within a scant 6 months, despite the very best cancer care that could be provided at the University of Chicago Hospital. And in the aftermath of this, 6 months later, she found herself speaking to me about her experience. Even with the wonderful palliative care that they received at the end of Kyle's life, nonetheless, it is a deep burden for her to carry. Let's listen.
Hi, Prof. Neimeyer. Can you unplug your earpiece?
Thank you for that. I'll go back and pick that up one more time. My apologies. Darla, I want to express my appreciation for your coming to talk with me this evening and to share with me a bit of a story and a painful one in your life. And I'm just wondering what you imagine this time might do constructively for you in sort of moving forward with that story.
Well, I'm very pleased to be here. I feel such great pain, the depth of my pain in losing my son. Sometimes just encompasses me to a point where I need to lay down and just rest myself. So I'm hoping that somehow I can find maybe new ways to cope, to somehow fill up this void, or how I can look at it differently to make sense, or I don't know.
So what does Darla tell us there? She tells us that she's contending with at least a couple of aspects of this pain. At times, and the camera unfortunately shifts toward me and away from her, she said she experiences a pain that just encompasses her, and she draws this encompassing pain as almost a kind of shroud around her body to a degree that she has to lay down and rest herself. It's something that is between her and the world. It surrounds her like an atmosphere. At other times, she says she's looking for a way to fill up this void, and she shapes that void at the level of her abdomen, at the level of her womb where she carried that child. She closes then with the plea to find some way to make sense of the experience, to make sense perhaps also of her own emotions in light of that experience. And this introduces for us, if we were to imagine that Darla is speaking on behalf of very many of the bereaved, it introduces us to the multifaceted search for meaning in loss. Here in this image of the painting Aske, which in Norwegian means ashes, by Edvard Munch, we see two different expressions of angst. Right? One very visible, the woman nearly tearing her hair out in what we could imagine would be a very audible and visible form of suffering. And we also see the image of the man hunkered down in the corner of the painting, experiencing maybe a kind of depressive constriction, a sense of shame in the aftermath of an implied event. In both cases then, we might be led to ask, what are these people contending with? What are they struggling with at the level of meaning? And what I'd like to suggest is that we observe many different facets of this struggle for meaning in the aftermath of hard transitions and loss. Our clients, our patients, our family members may struggle with issues around the death itself. And sometimes it's just understanding the course of the illness and the difficult treatment decisions that have to be made and their implications for the patient's longevity and well-being and consciousness. Sometimes they're about the role of the self. They may be questions like, why didn't I notice that these symptoms were more serious than they were? Why did I tend to dismiss them and say, well, you're just tired? Why didn't I force him to go to the doctor? Or why didn't I show up, right, in the final days? Why wasn't I there when my loved one died? All of these sorts of self-accusatory forms of questioning can also be understood as an attempt to make sense of a meaningless event. We may have questions about our own identity in the aftermath of loss. If I'm a parent who has lost his or her only child, am I still a father? Am I still a mother? Who am I when I lose a life partner who has been a witness to my life for virtually all of my adulthood? A sense of my own self is eroded, as that image by James Gleason suggests at the outset of our presentation. We may have questions of a spiritual kind about God's intentions or the nature of a universe that could randomly just place such suffering on our doorstep or on that of our loved one. We may have questions about ambiguous losses, what Darcy Harris refers to as non-finite, non-death related losses. And many of us are contending with such losses in the context of the current pandemic, when we lose a sense of predictability, a sense of control, a sense of personal agency, a sense of the future that we thought we were living toward, and much more. We may have questions about our fundamental purpose. What is the meaning of our life now? Now that our child has died, now that our partner is not with us, now that our parents are no longer part of our active living. And we may have questions about our own emotionality as we attempt to read the meaning of our embodied emotion. What do my emotions and bodily feelings tell me about what I need now? Sometimes I'm just overwhelmed with anxiety, fearfulness, a sense of abandonment, or a feeling of deep depression or grief. What do I need in all of that in order to be able to move through that to somewhere else? Now, as we contend with these kinds of questions, we sometimes benefit from models that simplify the complex realities that we suffer and that our clients contend with. And we need to have some way of understanding what adaptive grieving might actually mean. One is a kind of constructivist meaning reconstruction frame that looks at how we construct stories of our experience, even in the context of our acute grief. We're trying in some way, at some level, to process the event story of the death itself, or of our loved ones dying. We're trying to grasp its implications for our ongoing lives. We're trying to find a way to wrap our hearts and our minds around the reality of what's transpiring. At another level, we're also trying to access the backstory of our relationship with our loved one. We're trying to bring it forward in a way that reaffirms attachment security, a kind of continuing bond with our loved one, instead of simply a final goodbye or a rupture of connection. And often we're trying to reactivate the bond with the loved one, to bring them into the picture, into the conversation, in order to work on the unresolved, unfinished business of our relationship or of the story of their dying. All of these are factors we'll look at more closely as we move forward. And as we do this, we move toward a grief that is not just something we get over, like a bad cold or even a successfully treated cancer. Instead, we look to integrate the loss into our lives in a way that we can acknowledge the finality of the death, not just intellectually, but emotionally, viscerally. We continue to experience bittersweet emotions, but they weigh on us less heavily across time. We change our mental representation of our loved one. No longer is he or she sitting there at the breakfast table with us and having a conversation as the news plays on the radio. No longer maybe as a partner going to bed with us at night or a child being sent off to school. But they are very present in their absence. They're present in our thoughts. They're present in our stories. In many ways, we may even dedicate parts of our living to them. We construct a coherent narrative of the loss, meaning a story of what we have suffered and what they suffered that includes even the nasty bits, even the hard parts. So it's not a story that has to be censored. It at least can be shared with someone who is receptive to hearing the full account. And of course, it is an evolving story because our lives continue to evolve as we redefine those life goals and roles that now need to be reworked because the physical presence of our loved one is no longer a part of those lives. Now, about a few years ago, I had the opportunity in Singapore to present to the Children's Cancer Foundation. And I did a keynote for a conference that they hosted, a wonderful conference. And in that, they invited me to summarize the research that we had done across about 10 years of work on sense making and benefit finding and meaning making in bereavement. So in some ways, what I'd like to do is to take this time today to update that review and to focus on the last 4 or so years of research that basically advances the understanding of how meaning making works and doesn't work in the context of bereavement, especially with an emphasis on news we can use as practicing clinicians attempting to work alongside families and patients in dealing with these tough transitions. If I were to summarize those first 10 years of research in a nutshell, it would be this: that study after study after study by our large research network and many independent research networks that have replicated and extended these findings converges on the idea that sense making, the ability to make sense of the loss and our life and its aftermath, predicts better grief adaptation in a lot of different contexts: in palliative care, in relation to natural death losses as through advancing disease, in relation to violent death losses by suicide, homicide, natural disaster, fatal accident. And these same factors are predictive of outcomes in bereaved parents who lose children, bereaved older spouses who lose a partner, typically of many decades, bereaved young people losing friends, brothers, sisters, parents, grandparents, aunts, uncles, and others who are significant to them. It is a broadly applicable conclusion that sense-making predicts better grief adaptation. Except when it doesn't, except when sense can't be found in the loss. And so what I want to do is to focus first on those losses that tend to fragment our accounts of what we've experienced, that fragments our meaning structures, that leaves us separated from others in the experience. And so I'm going to refer here to a handful of studies that focus on processing the event story of the loss. And this is part of a trauma-informed approach to grief and grief therapy. It's part of what we focus on in our core training with the Portland Institute for Loss and Transition, whether it's in the online form in which we're currently offering training, or on-site work like we've done in Singapore over the past 5 or more years. And I'd like to introduce you here to a client of mine who speaks to one such loss. His name is Guy, and he is a Belgian father. Guy has lost not 1, but 2 emerging adult children, about 1.5 years apart. And the loss that he is currently overwhelmed by is that of his daughter, Sylvie, a beautiful and promising young artist at the age of 19. Here, Guy reflects with me in our therapy session, the outset of the therapy session, on the necessity of retelling this story of loss in a way that is restorative rather than re-traumatizing, as a cornerstone of our therapy. Let's listen to what he has to say.
So here's my question for you. And I don't have a secret answer that I'm looking for. It's really a very open and honest question. What would be the pros and cons, the advantages and disadvantages of reopening even a little bit the story of that loss, those experiences, those images, those feelings, as opposed to leaving it closed? Mm-hmm. Are there advantages and disadvantages to telling the story considered. I'm kind of asking for time to do a little bit of that.
I feel there is an absolute necessity for me to somehow find ways to tell the story. Because somehow it is a necessity for me to, as a part of integrating what happened to Sylvie into my life.
To make it real and a part of your life and not just left out of your life.
Exactly.
Yeah.
And I'm working, I feel at least I'm consciously trying to find ways, as we are sitting here.
Yes, yes.
As a part, but at own pace. And I admit trying to find safe ways, like making experiments as well on what feels okay and what doesn't.
I get it. And this is one such experiment that we're doing right now.
Exactly.
So Guy there is speaking, I think, on behalf of many of the bereaved as they try to seek, as he said, safe ways to integrate the reality of the loss into their life, to find a way to tell the story, to find someone safe to tell the story to. How do we do that? And of course, sometimes we have the benefit of a family dignity intervention that really invites those conversations. But this is something that we need to infuse into all palliative care and bereavement care to afford this safe space for this crucial work. Among the studies that we have done in these last few years is a wonderful project done by Jane Millman. It was a kind of protege of mine from McGill University in Canada, now living and working in the United States. And actually in Austin, Texas. This is the city that's named after Andy Ho's new baby boy, Austin. And what Jane has done is she studied risk factors for complicated grief, evidence-based risk factors, things that we know represent problematic context for grieving that set people up to really struggle with loss. And we were especially interested in the role of meaning making with reference to these risk factors. She's published this in a series of high profile journals, different aspects of this research program. And I'm just going to summarize a few of the kernels of what we carry away from this. What we did is we evaluated these risk factors that were observable in the first year of bereavement. And then we looked for those that predicted complicated, prolonged, intense, incapacitating grief responses in the second year. So this is a genuine prospective study looking at risk factors observable in year one that predict outcomes in year two. And you can see here that we were looking at violent death loss as one such risk factor, the loss of a partner or spouse, low social support for the griever, neuroticism, which basically refers to anxiety proneness, people who are temperamentally more reactive to events, anxious attachment, people who don't feel very securely bonded to other people and who tend to develop fears of abandonment in relation to that, and avoidant attachment, people who solve the problems of attachment by downregulating connections with others, avoiding them, basically not forming close interpersonal bonds. What we found is that indeed all of these risk factors observable in year one indeed predicted greater complicated grief symptoms in year two, but the way they did it was by decreasing how much meaning was made in that first year, and then meaning making, or the lack thereof, a struggle with meaning making, predicted complicated grief intensity in the second year. So, in other words, what I'm saying here is that meaning made mediated complicated grief. It was the missing link that translated the risk into these really complex and aggravated grief symptoms. In fact, the effect was so powerful that meaning made fully mediated the impact of anxious attachment, low support, and violent death loss. All of these factors were completely explained. All of the variants in them were completely explained by meaning made. And for all of the other factors, it basically meaning accounted for much, though not all of them. We also found that rumination moderated this effect. When people tended to ruminate and go over and over and over again the particulars of the loss or their relationship with the loved one, then that kind of preoccupation tended to be associated with even more intense, prolonged symptomatology. Now here, let me introduce another client of mine. And I will bring her up in just a moment. Let me tell you that she is Lauren, and she has lost her young son, little Norris. Here in the opening moments of therapy, she gives attention to a particular domain of meaning making, having to do with her spiritual framework and how this plays into her ongoing grief many years following little Norris's death. You were looking for some way to, I guess you've said twice now, to make sense of it, right? To find some kind of a meaning or a way of coming to terms with it.
Mm-hmm.
And what have you found along those lines, whether in your own heart, in your own family, in terms of spiritual beliefs, readings, conversations with others? What kind of sense do you now make of this impossible journey that you've been thrown into?
Yeah, I don't think I'll ever make sense of it. And you never,
Yeah.
I can't make sense of why. I never understand. We do have strong faith in God. I'm a believer. I'm a Christian. I think all things work together for good. I don't know why God uses lessons
Of this kind.
But at the same time, I feel like our oldest son was such a light, and he was such a joyful, he was such a larger than life person, being. And I feel like if we don't do the right thing, if we don't do good things moving forward, then we're not honoring him. So I think it's the best way to honor him is to do good things in his memory and move forward. And then also serving our other children well.
Mm-hmm.
So it's our duty in a way.
So, I mean, this is just an intriguing idea to me as you describe it, because it seems as if what you're telling me is something like, Bob, I can't find a meaning that makes sense of this loss in terms of an explanation for it, a justification. That even with my deep Christian conviction that there is a God, right, who plays a role in human affairs, I can't understand a divine purpose that would mete out a lesson this harsh, right? But what I can do, Bob, is to find some way of, I don't know, preserving the meaning of Norris's life,
Mm-hmm.
right?
Mm-hmm.
And indeed continuing that larger than life presence in a way that memorializes it, extends it, kind of keeps his presence alive in a way. Keeps his presence alive. So what we hear is that this is again a multifaceted attempt at meaning making, and the part that has to do with in some way honoring her son, they're on top of that one. The part that has to do with the spiritual significance of the loss, a kind of understanding of God's intentions, not so much, despite their deep religious conviction. This is an ongoing issue for them many years following Norris's death. These kinds of observations in the context of clinical practice led us to be quite interested in the phenomenon of grief and spiritual struggle or spiritual crisis. And in one such study, and we've done several now with different groups who vary in ethnicity, vary in the mode of loss that they have experienced. In one such more recent study, we studied nearly 60 religious mourners who suffered varied losses. So some had lost partners, children, parents, friends, a variety of important figures, siblings. And we found that violent death was characterized by more negative religious coping. And what we mean by that is the degree to which people question God. They question the intentions of the universe. They tend to have real struggles with their faith. They may lose faith that they are indeed loved. And we also found that spiritual struggle was associated with higher levels of depression throughout bereavement. Now, what does this sound like in the words of the bereaved participants in the study? And let me cite the experience of a couple of African-American women, conventionally a very religious group of people. And here we see them contending with that complicated spiritual grief. This woman is grieving the homicide of her 18-year-old grandson that was just gunned down in this violent culture that the United States has. And she said, I felt that God had allowed the capriciousness of life to invade our world. I wondered aloud if our entire family and our belief system were merely a cosmic joke. I questioned why God permitted such a painful and horrendous act when he had the power to stop it. Right? So this is a real loss of a sense of connection with God, a trust in God. Another said, right, having grieved her husband's death by cancer, and again, he benefited from good palliative care, but this didn't solve all the problems for her. She said, I thought I could rely on my church community for support, but they grew tired of trying to console me, and they took advantage of my vulnerability. They said they'd be there for me, but I didn't know that there'd be a time limit. Right? After a couple of weeks, she found her faith community was beginning to doubt her faith because she wasn't celebrating her husband's homegoing instead of grieving as she was. These kinds of studies that we've done and these kinds of clinical experiences with mourners like them led us to formulate a measure called the Inventory of Complicated Spiritual Grief, and then to revise and extend it into a version 2.0, along with Laurie Burke and Elizabeth Crunk, who you see depicted here in the picture. We developed a multifactorial scale for spiritual distress and bereavement. We tested it out with nearly 450 Christian adults. And we found a very clear factor structure, high reliability for this. And I'll tell you about the factors we found in it in just a moment. What we found is that people who scored high on this measure of complicated spiritual grief tended to have a lot of questions, a lot of struggles with the divine, a lot of struggles with the demonic. They saw the role of the devil in human affairs being very diabolical, very destructive. They had a lot of interpersonal struggles, moral struggles, struggles with doubt, questions about ultimate meaning in life. So this was a pervasive kind of problem. And it correlated with a profound crisis in meaning on the integration of stressful life experiences scale, where people are saying, I can't comprehend the death. I can't find my footing or grounding in the world following this loss. And we found that the ICSG, the Inventory of Complicated Spiritual Grief, predicted more complicated grief symptomatology even after you controlled for general negative religious coping. Why? Because it looks specifically at complicated spiritual coping in the context of grief and bereavement. So it's the only measure that is specific to this form of loss. And as I said, we identified 3 factors in it that are worth paying attention to. One is this notion of insecurity with God, and this is represented by items like, I'm confused as to why God would let this happen, or I feel angry at God. Another cluster of items focus on estrangement from the spiritual community. Right? So people are endorsing items like, people in my spiritual community don't want me to express my grief much or at all, or my spiritual community might reject me because of the way my loss has reshaped my religious beliefs. They're beginning to doubt that I really have faith. Right? If I did, I wouldn't be grieving so much. And a third dimension has to do with disruption in religious practices. And here I love this image. It's kind of subtle, but you see the human figure at the base of this cliff, just and facing what seems to be an impossible challenge to somehow climb out of this hole. And maybe the traditional religious practices on which he is counted to get through experience just aren't working at this time. So on this scale, people are saying, I find that spiritual or religious activities, prayer, worship, or Bible reading, are no longer fulfilling to me. They no longer have any meaning. They don't help me. I have lost interest in them, or I've walked away from my faith altogether. Sometimes people will leave their church community and try to find another, or just stop going entirely. Now, I think the ICSG is one of those several measures that can really be helpful, especially if one is dealing with mourners who are in one of the monotheistic traditions of Christianity, Judaism, Islam, the whole Abrahamic tradition. Of course, in other traditions, such as Buddhism or Hinduism, it may not apply in the same way. And so I'll refer to some work that we've done in other religious contexts as well. Here, though, I want to use this as a preface to the work that we've done to examine anticipatory grief in a palliative care context. And again, this is spearheaded by my colleague, Laurie Burke, the same one who was really the principal researcher in the work on complicated spiritual grief. We published in the Journal of Social Work in End of Life and Palliative Care, a study that I wanted to summarize with you here. Here I show you an image in the final weeks of my mother's life, and we see Mom here on the left, along with my sons Eric and Michael at a younger age, as they also would visit her during that palliative care period. We were interested in anticipatory grief as a kind of anguish state of protest, confusion, pain, as people experience the looming death of their loved one. And we made use of a pretty well-constructed scale by Toit, Jordan, Ross, and Deutsch, about a little over 25 items here, 5-point Likert scale rating, assessing both positive and negative coping with the looming loss of a loved one. And you see here some sample items. Things like, I felt very much alone since the life-threatening illness diagnosis was made for my relative, or I blame myself for my loved one's illness, or I feel detached, emotionally cut off from them, these kinds of things. And we use this scale then to study the adjustment of 57 family members of hospice eligible patients in palliative care. And we were looking for factors that predicted more intense, more anguishing anticipatory grief. The first finding was the interesting negative finding that we found that there was no relationship of anticipatory grief to the race or ethnicity of the people involved, and it was quite a varied group of people. We found no relation with the character of the relationship with the deceased, whether it was a spouse or a parent being lost, for example, or a child. And we found no relationship with positive religious coping. People who would speak of the importance of their faith in turning to God or to their articles of faith and belief were no more likely to experience a softer anticipatory grief than those who did not engage in such coping. So religious coping alone was not really predicting how people were managing this. The question is, what was? And I'd like to share that with you. These were the leading risk factors for anticipatory grief in our study. Those people who really struggled to make sense of what was happening, the looming death of their loved one, what that meant for them, and possibly even understanding the context of care and the treatment decisions. Low meaning making about all of that was associated with much more risk of complication in their anticipatory grief. Likewise, high dependency on the loved one. Perhaps it was a parent, perhaps it was a spouse. And in the context of high dependency, there was much more of a chance for high grief and anticipation of the death. These were the two most important factors. You also see, though, that other important factors include spiritual struggle, low social support. So when you find a mix of these going on in the context of palliative care, this can cue you that these are people who really need some assistance. And why do they need it? Well, because anticipatory grief establishes a context for long-term complicated grief well beyond the death of their loved one. Here we see my wife, Kathy, giving a kiss to her mother as she passes away, and in the presence of her brother, Jim, also attending the bedside at that point. So what we grew interested in here were prospective predictors of complicated grief in palliative care. And we published the results in Illness, Crisis, and Loss. I want to give you a sense of what we found just very quickly. We found that pre-loss predictors of complicated, intense grief included the sex of the survivor, at least in our sample. Women tended to be at higher risk than men, possibly because they were more intimately bonded with those who were dying. The loss of a spouse was also a risk factor relative to the other forms of death. And high levels of anticipatory grief were a real warning sign. So those people who anticipated the loss with a lot of anguish before they died were the very same who were likely to experience profound difficulties afterward. What other psychosocial predictors did we observe? Well, you can see here that, again, anticipatory grief and dependency there in the pre-loss period pointed toward greater struggles with grief months later. And of all of these factors, we again see, again and again and again, across different studies, across different measures of meaning making, across different populations, modes of death, the same finding keeps emerging. Low meaning was the single strongest factor in terms of contemporaneous post-loss lack of meaning, the strongest predictor of people's long-term complicated grief responses. And you see here that low social support is also an important factor. So when people are reporting these kinds of experiences, or we're observing these kinds of experiences in the palliative care context, we should really be thinking about a referral for longer-term support. So let's just pause here for a minute and consider some principles of practice that are implied by these and other results that really begin to generate guidelines for dignified care at the end of life, and in a way that benefits families as well as the dying themselves. And there's a whole cluster of concepts implied, for example, in the FDI, the Family Dignity Intervention that Andy and his capable crew have devised. And they, of course, feature themes of meaning. They work with people's memories. They build legacy in part through legacy documents that record those life lessons and the stories of a life. They may include photo review and harvest the wisdom and significance of the life of the person who has passed. If we were to boil this down into a few simple dictums or guidelines, I would offer these. We need to speak the truth with people about their condition. We need to encourage candor about the illness and to look for signs of the patient and family's readiness to engage in these important conversations. At a time when people often cannot be alongside their loved one at the bedside during this time of COVID containment, we can at least encourage them to connect visually, to show up in a video conference mode, to show up on FaceTime on your iPhone, not only to limit the interactions to voice contact only. Anything that more closely approximates full human contact will be beneficial. We can help people build legacy. We can invite the stories of a lifetime. We can record these stories as we talk with our loved ones, even on the phone or in teleconference. We can share memories with the patient at moments of consciousness, conveying appreciation, humor, love. We can review photos and share with them, celebrating high points, acknowledging low points in our lives together. We can solicit their counsel, their words of wisdom, the life lessons that they might want to pass on to the family. And of course, this is the kind of thing that the FDI does a wonderful job with. We can also take dictation, or we can have them dictate and then record in an audio mode letters or memos in a way that can be shared with specific others to whom they'd like to give a message, even to those who are too young at present to understand what they might understand 5 years later or 10 years later when it could be offered to them. And we can help them make meaning, to explore what has significance now, to slow down the hectic pace of treatment and the whirl of activity in the context of a hospital or care facility, and to really just begin to engage. What is it that we need to give attention to now? What is important to you now? Andy yesterday suggested some ways in which people try to find control, for example, by even having more control over their diet. They want to eat some junk food, so they ask their family members to bring it in. In small ways like this, they can meaningfully reclaim some sense of personal agency. Now, part of attending to people's dignity and to adaptive grieving is recognizing that people have a capacity to grow through grief. And it's not that they grow rather than grieve, it's that they grow because they grieve. In previous research, we've well documented that when grief is at a moderate level of intensity, people are likely to experience the greatest growth. When they experience very little grief, well, there's not much stimulus to grow. They just kind of go on doing what they've always done. And when the grief is overwhelming, there's simply way too much to deal with for them in order to be able to make sense of it and grow through it. So we've been very interested in this idea of post-traumatic growth, Tedeschi and Calhoun. And I think it's represented beautifully in this image by the artist Mary Hobson, where you see this human figure, a woman bent over, doubled over. We might imagine she's doubled over in grief. The lettering stamped on the image says "in loving memory of," and gives her mother's name. And in fact, her very body is a letter to mother. And yet at the same moment, when we look closely at it, we also, of course, see this butterfly-like wing, that it's almost as if in the cocoon of grief, she is growing the wings of new possibility. Mourning is also a metamorphosis, a potential transformation. Now, shifting from art to science, let me see if I can explain the most complex study that I'm going to include in my review today. It's complex because it approaches things really differently than we usually do. It conducts what is called a network analysis of complicated grief and of post-traumatic growth, done by my one-time student and now young colleague, Ben Bellett, with some colleagues of his at Harvard University, where he's getting his doctoral degree. And it was published in Clinical Psychological Science. what they did was a network analysis. Now, let me just give you a general idea about this. The usual way that we explore sort of psychiatric diagnoses or medical diagnoses is we assume that they represent an underlying condition. There's some kind of an underlying process that generates symptoms. We can only measure the symptoms and then infer the underlying process. So if people experience anhedonia, the inability to experience pleasure, and they have sleep disruption, and they experience profound fatigue, and they have a low sense of self-worth, then all of these would be symptoms of an underlying depression. That's usually how we go about studying and understanding it, and then we relate depression to other things. But in network analysis, we change the question in a very interesting way. We say, what if there is no underlying depression or underlying complicated grief or prolonged grief disorder? What if the symptoms are the syndrome? What if the interaction among symptoms like sleep disturbance, then sort of activating or feeding into or reinforcing low energy, and then that affecting our degree of interest or engagement in sex or other activities that we once found pleasurable? And what if we saw the symptoms of a particular condition as the problems, and if we were then to do an analysis that looked at how they linked to or activated one another? That's the key to network analysis. So here we have all of these symptoms of complicated grief in a sample of nearly 500 bereaved adults. So things like anger about the loss, shock, non-acceptance, yearning for the deceased loved one, feeling that our identity is changed and diminished, a part of ourselves have died with the loved one, not caring about people, not trusting others, a kind of meaninglessness about our current life or in the future, a sense of discontent, numbness, a lack of control. And what we were able to do then and I'll spare you the statistics, to look at how these different symptoms bridge to and activate one another within the network of complicated grief. The stronger the green lines are linking them, the stronger the bridge or influence between the different nodes. And if you look at the factors that are the most important ones in the network and their expected influence on other symptoms, shifting your attention to the right-hand side of the screen, the farther you go to the right, the more powerful the connections are between these core symptoms and the rest of the network. And what we find is that the very most important factors are lack of control and identity disruption, followed by meaninglessness and confronting a future that seems bleached of meaning. These are the most critical components. Now, why is that useful to know? Because if we have to concentrate on certain symptoms, we want to choose those that are most likely to have a beneficial impact on the rest of the system. That if we can help people, for example, to achieve some sense of control, maybe even by choosing the food they eat, right? Or choosing the time that they wake up, as Andy was talking about yesterday, we may do a great deal in minimizing their complications around grief and loss. Likewise around identity development. But we are equally interested in people's capacity for post-traumatic growth. And here we're looking at not symptoms, but elements, because it's not a problem, elements of post-traumatic growth, feeling that we are in some ways better people for having survived the loss. We find a new path through life. We change our priorities. We can handle things better. We have more appreciation of life. We feel stronger as people, closer to others. We experience a reinforcement of our faith perspective, or our spirituality, whether it's secular or religious. And here, again, if we look at this network, we can ask, what are the really pivotal elements in this? And again, we find this idea of if we look at the right-hand side, finding a new path through life, feeling greater strength, followed by our spirituality. These are pivotal factors that if we can find a way of working with them, then we can likely really promote people's sense of growth through grief. There's one more piece here to this interesting puzzle. So we asked ourselves, what would be the critical bridge between complicated grief on the one hand and, on the other, people's sense of post-traumatic growth? If we know that it's grief that stimulates growth, what about it does so particularly? And here, again, if you look to the right, you'll see that far and away the most important bridging feature is the assault on, the challenge to our existing world view, our existing meaning system. These basic world assumptions, maybe that life is predictable, that we have an ability to influence it, that the universe is just, that God is looking over those who have faith, and so on. As all of these fundamental assumptions are shaken, we have to rework our worldview, and it is the reworking of the worldview that generates the post-traumatic growth in this analysis. So very, very interesting. Again, a really different way of doing the analysis, and yet it points to exactly the same thing, that meaning is pivotal. Meaning is the bridge from suffering to significance. But it's not just something that happens in our head. It's not just a cognitive process. It happens in our lives. It happens in our conversations with others, for better or worse. And so Ben Bellett, the very same guy who spearheaded the project I just described, also spearheaded the development of what we call the SMILES, which stands for the social meaning in life events scale. And we looked at processes of social validation and invalidation in grief. What do we mean by this? Well, in social invalidation, we're talking about people who tend to diminish people's capacity to make meaning of the loss. They disenfranchise people's grieving or the grievers themselves, in the words of Ken Doka. And this experience of others as not understanding us, as criticizing or judging how we grieve, or that when we talk to them, we're more confused rather than more clear about what the death was all about and what it means for us. Social invalidation was a strong predictor of people's complicated grief responses. On the other hand, social validation didn't necessarily make them grieve less, but it made them grow more. So when people felt they were surrounded by others who really got them, and that when they shared their experiences with others, it made a fuller kind of sense to them, they were far more likely to grow through grief. Now, let's take a culturally relevant look at how these processes of social invalidation can play out in a Chinese cultural context. And here I want to refer to research that will be published by my friend and colleague, Heng Chong, or Edmund Ng, who is a Malaysian therapist, counselor, and he was my doctoral advisee. He just completed his doctorate at a venerable age because he's so interested to contribute to the field. And he did a wonderful study. He studied social invalidation and shame in the context of perinatal loss. And he did so in a Chinese cultural frame. Specifically, he was working with people in Malaysia, which is where he lives, in Kuala Lumpur. And he administered the SMILES, this measure of social validation and invalidation, an index of complicated prolonged grief, the PCBI, and an internalized shame scale to over 40 Malaysian Chinese women who suffered the loss of a child to miscarriage, stillbirth, the child being born dead, or perinatal loss in the earliest hours or days of life. And what he found is that their experience of social invalidation was powerfully associated with their level of shame and their level of complicated grief. That is, complications in bereavement were a function of shaming processes, and a mediation analysis clearly suggested this pattern. So social invalidation leading to shame, leading to complicated grief. What do these women have to say? Just as an example, a small sample of the qualitative study that also accompanied this quantitative one. They said things like this in their qualitative interviews. I'm fearful of what others will think of me after the loss. I don't feel as adequate as before. In a sense, there is shame. I started to compare myself with others of the same age, and I asked myself why I cannot give birth. Am I so worthless? My mother-in-law asked me, what went wrong? I said, I don't really know. I feel ashamed. And then I said, I am sorry that I disappointed you. So this sensitizes us to, again, the need to work not only with individual clients, but also with families, and particularly in cultural settings in which the family and the social world is so crucial to people's sense of identity and worth. Drawing on an Eastern perspective, we have also sort of mined the resources of Buddhism, specifically Zen Buddhism, in a project that we conducted in New York City at the Zen Center for Contemplative Care associated with Beth Israel Hospital. And one of our co-therapists in the project I'll describe to you was Chodo, Robert Chodo Campbell, who is a Zen monk and who worked alongside Polly Young Eisendrath, my Jungian psychologist colleague, and myself in carrying out what we called the Mustard Seed Project. It was a kind of intensive weekend workshop. We integrated brief meditation to the group of folks we worked with. We did a couple of different iterations of this. About 40 people in all took part. And it also included secular Buddhist Dharma lessons. We weren't trying to turn anyone Buddhist. In fact, very few of the people who participated claimed Buddhism as their spiritual frame. They were New Yorkers. They were Jewish. They were agnostic. They were Christian. They were a variety of things. And there were some Buddhists among them, but not principally. But we talked about basic Buddhist Dharma lessons, kind of the basic teachings of the Buddha. And these included dukkha, the idea that suffering is universal and it's nobody's fault. Anicca, impermanence, the notion that we are wired for attachment in a world of impermanence. Ultimately, every person, every place, every project, every possession we love, we will lose. And that will be a source of great suffering for us. Anatta, the idea of the transcendence of ego, the idea of no self, that we are not radically individualized consciousness, and transcending the illusion that we are is part of the goal of seeking wisdom. Of course, the project involved some practices of deep listening, and we also included expressive arts modalities. I gave my own kind of Dharma lessons, I guess, focusing on intervening in meaning and understanding loss as unwelcome change that attends the challenges to or the shattering of our self-narratives, our stories of who we are and what our lives are about. We talked about the ideas of meaning reconstruction, some of which I'm summarizing for you here, but we put it in lay terms and briefly. We had people do poetry readings aloud and draw on the poetry and discuss their meaning. The poetry was evocative of themes of loss and its significance for people. And they also used something called virtual dream stories that I'll mention in a bit more detail. We encouraged a good deal of dyadic sharing, where people would tell their stories of loss to a partner, and then the partner would share these with others. We also shared and paired in a number of different points in the workshop, in between meditation and Dharma lessons. So it was a very experientially rich weekend. And supplementing then these kind of lessons in Dharma, we also had people harvest images from poems that we would read and share, and then use these images, these phrases and words that struck each one, to formulate what we call virtual dream stories. And these are kind of imaginary stories organized around the particular elements that they had chosen from a poem. And people use these then to scaffold and prompt stories that they would write quietly on their own in 8 minutes and then share with another. And I have to tell you, these stories, though they were stories that were make-believe, were incredibly autobiographical, because people used them as an opportunity to project key meanings and themes and experiences of their own losses into this fictional account. And in this way, they could achieve a little more distance and perspective from them. They processed them with partners and with the therapists. And this kind of rich multimodal experience had a big impact on people. We saw big increases in people's level of meaning making about the loss, even over a weekend. And it showed up in a couple of different dimensions of the aisles, the integration of stressful life experiences scale. We also found a substantial reduction in grief-related suffering on the Hogan Grief Reaction Checklist. People reported less despair, less panic, less kind of depression and anxiety about the loss in the aftermath of the workshop. And most interestingly to me, they reported substantial increases in personal growth as measured by a subscale of that same measure. So what we find here then is that even brief interventions that are organized along meaning-enhancing lines, sometimes they may draw on the spiritual traditions that carry a lot of wisdom for us, can go a long way toward helping people both surmount their symptomatology and move toward greater growth. And I want to touch just quickly here on some other studies that really have to do with the backstory of relationship with the loved one, and to make some points about an attachment-informed approach to therapy. And here suggested by this image by Heloise Christa, Through a Glass Darkly, where someone seems to be seeking contact with a loved one in another dimension. Along with other members of the transition team, Jameson Bottomley and Melissa Smigelski, we have investigated the risk for severe grieving as a function of relationship quality among people. And we did a couple of things. First of all, we devised and validated a quality of relationships inventory and a bereavement version that helped measure the level of closeness and conflict with the deceased. And just trust me that this shows strong validity and reliability. And then we applied that and another measure of anxiety and avoidance in people's attachment styles. We were interested in how people's basic orientation to attachment, especially with the deceased, interplayed with the level of closeness and conflict that they had with them to produce more complicated forms of grieving. Let me briefly summarize this for you. If you look on the left-hand side, there you see those 3 lines, and they're kind of veering up. The line on the top represents people who described the relationship with the deceased as very close. And then the next line down is moderate closeness and low closeness. What this tells us is that the higher the line is, the greater the grief severity. And naturally and commonsensically, when we lose someone to whom we feel very close, we are likely to grieve more intensely. But the interesting thing to us is how this interplays with people's level of attachment anxiety. because there's a strong interaction effect here. So if I have low anxious attachment, I connect with people easily and confidently, I trust that I will be loved, I trust that people will not abandon me, they're going to be there for me, then in such cases, I'm likely to have lower grief. Whereas the more anxious I am about the rupture in relationships and abandonment issues, the more aggravated my grief is likely to be, particularly, as you see here, when what we lose is a close relationship. So this is a perfect storm for complicated, prolonged grief. When we lose a close person and we have a highly anxious attachment style. If you look on the right-hand side, you see three other lines here. And here, the top line represents relationships that are marked by high conflict, right on down to low conflict with the third line. Again, the more conflictual the relationship, the more complicated the grief. But for whom is it most complicated? When we ourselves have minimal attachment avoidance, that is, we're oriented to attachment, we connect with people, we bond with them, then high conflict in the relationship has a huge impact on our grief, and it's likely to be very complicated. Whereas people who are very avoidant in their attachment styles, look on the right-hand side where all three lines diminish, they report very little grief because they're not that connected to people to begin with. Maybe they compulsively rely upon themselves and they have very little sense of really bonding with other people. So some attachment styles may be protective in this sense. And I think I won't share with you the vignette I was going to about an illustration of this, but just to say that this was a client of mine who is a 50-year-old woman. She was gradually losing her mother, who was in palliative care and memory care for increasing dementia. She felt like she was losing mom one neuron at a time, and her alarm bells for separation distress were really going off like crazy, because when she was a little girl at the age of 4, her dad died in a violent car accident, and possibly by suicide. So she had been all her life very anxious about loss of attachment figures, including mom, even though the relationship with mom, though very close, was also very conflicted. So again, this was the perfect storm for a viral form of grief. And she said, I'm like a frozen computer that's so busy dealing with an internal virus of working with this issue of mom's death that I'm unable to engage with other people or activities. It just was totally preoccupying for her. And the alarm bells went off still further when I told her that I was heading to Singapore for 12 days to do some training. And then her anxiety went through the roof because yet another secure base for her was in question. Now, if we were to say, what ultimately is troubling people in terms of these attachment issues? Well, it comes down to a lot of unresolved relational issues. And these can take a couple of different forms. One of them is conventionally referred to as unfinished business, right, in bereavement. And this is what we studied, and the we here is Jason Holland and other collaborators, in a group of over 225 bereaved adults. The one thing we found at the outset was very striking. That is that unfinished business and bereavement-related regret were amazingly common in this group of people who had all kinds of losses. And 42% of them reported regret about actions taken or not taken before the death, especially their own actions. And nearly as many, 38%, reported unfinished business about unresolved conflicts with the deceased. The level of distress about these two factors strongly predicted the intensity of people's complicated grief symptomatology, their inability to move through this and to, in some way, move forward with their lives. Now, yet another study that we've done recently explored one particular face of this, and I want to introduce this image to just convey it. This is by a Belgian artist named Jeanette Rietberg, and it's in Dutch or in Flemish, it's Altijd één kind tekort, which means always one child short, one child too few. And you see here this kind of shadow-like form of the missing child who will always be missing from the family, however much joy the others bring. So I want to talk to you here quickly about a study done at Memorial Sloan Kettering Cancer Center in New York on parental regrets in the context of the death of a child through cancer. This is spearheaded by my friend and colleague, Wendy Lichtenthal. Many others of us joined the research team. It was published in Palliative Medicine recently. And what they did was recruit nearly 120 parents who lost a child to cancer. And look at what they found. 73%, not 40%, as in the other study, 73% experienced profound regret, especially regret about treatment decisions. Should they have switched to a different protocol? Should they have for more aggressive treatment? Should they have pushed for less aggressive treatment because the child's quality of life was so impaired under the regimen? These parents, 3/4 of them were consumed with regrets around these end-of-life factors. This tells us clearly what we need to be doing a better job with in palliative care settings. And Memorial Sloan Kettering provides excellent services in these regards. In addition, 1/3 of them expressed significant unfinished business in bereavement, a kind of sense of conflicts with the child that in some way needed to be redressed. Both factors were associated with guilt during the active period of the caregiving. These parents were consumed with guilt as the treatment advanced and ultimately failed. And these factors also were predictive of the intensity of their subsequent grief. In fact, 60% of those who reported unfinished business on their own sought mental health treatment afterward because they were having such a hard time with this. So this is something that goes well beyond the days in the hospital, and it finds its way into the practices of many therapists, especially if we specialize in grief work. In order to get a clearer bead on this, a group of us then, again spearheaded by Jason Holland, developed, validated, and applied the unfinished business in bereavement scale. And again, this was a careful process of development to yield a very viable with a couple of clear factors. Total of 28 items, and they include things like, I wish I had told my father how much he meant to me, but I never did. Right? Or I wish I could have attended to my mother's needs more closely in her final days. Or I should have been there when my child died. Or I held on to a secret that I wish I had told my spouse, or I wish I had a chance to tell her that I forgive her. These are different facets of unresolved issues, and they factored into 2 identifiable scales, one of which focused on unfulfilled wishes. These were unspoken affirmations, missed opportunities. I never told him I loved him. We had a cutoff, and I never repaired that before she died. And unresolved conflict. These are the unaddressed disputes, indiscretions, a need for forgiveness on one or both parts that never was successfully implemented. And this was a big deal. This was a big factor that, along with meaning made of the loss, if you take into account just 2 factors, the struggle to make meaning of the loss and unfinished business in the loss, focused again kind of on that trauma-informed and the attachment-informed perspective. This accounts for the majority of people's complicated grief symptomatology and the aftermath of that death. 50 to 60% of it, then a couple of different samples that we tested. So this is a deal. How do we work with this? Well, we can do so in a lot of ways. One of the ways that we've attempted to do so is with devising a meaning and loss telehealth protocol that we have implemented and compared to a waitlist control condition in a small open trial. We implemented this on a video conference platform in an individual therapy context. I trained a Portuguese group. Thank God I didn't have to speak a lot of Portuguese, just a little bit, and they were all very good at English. So, and supervised them to implement this protocol. They did so, and the protocol was organized in terms of a variety of themes that will be familiar to you, kind of reopening the story of the loss, and helping people process the event story, access the backstory across a series of 12 sessions. We focused on a variety of different interventions, and I can only briefly mention a few of them here to illustrate it. And we'll need to wrap up here, Andy?
Yes, we do. Thank you, Bob.
Okay. Could I just simply say that we invited people to introduce the deceased into the group, to remember them with generosity and to essentially consolidate their continuing bond with the loved one. Sometimes to correspond with the deceased symbolically, to write hello again, rather than to say goodbye, and to do so in a way that allows to address unresolved issues in the relationship. So specifically firming up the bond and addressing unfinished business in a way that showed impressive effects in reducing the number of people who met the criterion of complicated grief in the treatment group, and also showing considerable improvement in depression, for example. Other therapies of a meaning-oriented kind show similar kinds of reductions in depression, prolonged or hopelessness. So we're beginning to develop guidelines based on these for dignity-oriented care in bereavement, as well as in the context of end-of-life care, as we encourage people through journaling, sharing photos, sharing their grief experiences, constructing legacies, reinforcing their resilience, living in the now, using rituals, in all of these ways to make meaning of their losses, using a variety of strategies that we offer training in the Portland Institute, including forthcoming training in Singapore by Carolyn Ng, our associate director, who lives right there in your city and country. And others of us also offer online training and virtual live training through the Portland Institute. We hope you might be interested in some of that. And let me go ahead then and close the slides and stop sharing and come back for at least a few minutes of questions maybe.
Yes, thank you, Bob. That was really inspiring. I really liked how you tied meaning construction with anticipatory grief and also complicated bereavement all together in such a profound way. We have a lot of questions that came in, and one was from Peeling, who talked about that when they work with family, we often find that guilt is a recurring theme, a crippling emotion that hinders them from expressing their stories. And she want to ask you, Bob, that what is the key in working with families who are experiencing immense grief?
Well, of course, one is to assist people with emotion regulation to begin with. We need to, and for example, yesterday you invoked the idea of mindfulness and meditation. These can be very soothing. We also implemented that in the Zen-oriented mustard seed project. But this is something we can do in session with simple breathing exercises. We can put them in a place where they're able then to make more sense of their loss. We can then use specialized interventions to try to address things like that crippling guilt that the questioner asks about. And that often involves invoking the presence of the deceased and fostering a symbolic conversation, maybe using empty chair work in order to resolve issues, where the client will enact the part of both the self and the other in order to provoke healing dialogues, or correspondence with the deceased, exchanging letters symbolically with the deceased that address these factors.
Thank you. Another question that came in from Yu Yan talked about that him himself has or herself has experienced different losses in her life, and his father was in his 80s, and he's experiencing deep grief from the loss of children as well as the spouse. And she wants to ask, what are some of the differences in supporting elderly who has lost children versus other type of grief such as spouse and siblings?
Well, certainly when we lose our children, as the Chinese saying goes, the white-haired should never have to grieve the black-haired, right? I guess the red-haired are never grieved by anybody. That's implied as well. But when it reverses the natural order of things, of course, this is even a more profound assault on our assumptive world of how life is or should be. Our sense of justice is in some way broken, and our sense of legacy is also challenged. We can help people find other ways to express legacy, perhaps with other living relatives, to confer life lessons, legacy documents, also to share their wisdom with other people who can benefit from it. And for example, in the US at least, there are, not nowadays in the COVID era, but at other times, partnerships between preschools and elder care facilities. And the older adults in residential care just love the visits from the kids, and the kids love having the extra grandparents. And so there are ways certainly to foster meaning making at the end of life, even across generations when they are broken by loss.
Mm-hmm. Maybe we have time for one more question. So an anonymous attendee asked that in your sharing, Diala expressed a desire to want to make sense of her pain. She knows that she wants it, but how do we help others who don't know what to do with their pain, or those completely lost in the grief?
Well, I think that's a common experience, and it may be even more common in Asia, where suffering may be translated more quickly into physical symptoms, rather than taken as a reflective opportunity to consider what our pain is telling us about what we need. But that's where, as psychosocial care providers and counselors, we can do a good job. We can invite people to slow down, right, across the bridge of some mindful breathing, right, to place their attention in their bodies, right, not in but near the place that they hold their grief or their pain for this particular person or loss. And then just to describe what that pain might look like, even in visual terms. If it were a shape, what would it be? If it had a color, what would the color be? Is it moving? And ultimately then to begin to speak from within that pain. If that pain had something to tell you or teach you, what would it be? People can often then begin to voice the implicit meaning of the pain, which often calls them toward greater connection, greater self-care, greater wisdom, greater acceptance. And so it all begins with helping people understand themselves in order to understand their loss.
And I think you brought up a really important point that sometimes we find it hard to verbalize or even articulate our grief, and using more creative mediums to help us visualize it or feel it and even listen to it can be much sometimes easier way for us to express that type of emotion that's so complicated.
Exactly, and this is why in fact, some of the interventions that we are providing training in specifically this month through the Portland Institute for Loss and Transition are specifically around creative writing protocols, for example, to help people with their grieving. So perhaps we'll have a chance to work with some of the folks who are listening.
Yeah, we really look forward to that. Bob, thank you so much for your time. It's been a profoundly inspirational presentation. I learned so much myself from listening to you, and I probably want to connect with you to ask about some of the scales that you're using in your study and about your network analysis. I'm fascinated by that. So thank you again for your time, and I look forward to seeing you on Friday when we have a panel discussion.
I do too, Andy, and thanks for inviting me to the party. Shishi.
Thank you.